Today, we're going to pull back the curtain on a really critical moment in healthcare. That conversation where you learn about your own health, it's actually way more than just a chat. It's a carefully thought out process designed for one main thing, to make sure you walk away with clarity. So let's dive into how it all works. I mean, we've all been there, right? You get a diagnosis or a new prescription or this long list of instructions, and suddenly your head is just swimming in medical jargon and a bunch of to-dos. It can be totally overwhelming, and let's be honest, a lot of it just doesn't stick. Well, you're definitely not alone in feeling that way. And that exact feeling of confusion, that's what this whole process is designed to prevent. See, behind the scenes, healthcare professionals are using a deliberate playbook, a strategy to make sure the information they give you isn't just heard, but that it's clear, understood, and actually useful. So let's get into that playbook. Because this isn't about just having a friendly chat. Nope, it's a structured blueprint, and every part of it is designed for one thing, making sure you actually learn what you need to know. The best way to think about it is like a pilot's pre-flight checklist. Seriously, every single step is there for a reason, all to ensure a safe and successful outcome. It's this methodical approach that makes sure nothing important gets accidentally left out. And here are the 6 core steps of that checklist. It all kicks off with step 1, figuring out what you actually need to know. Then, step 2 is all about setting clear goals for the conversation. From there, in steps 3 and 4, they give you the info and you, the patient, take it in. But it doesn't stop there. Step 5 is all about feedback, which is a super important check-in. And finally, step 6, did it work? Was the teaching successful? It's a whole cycle. Okay, so you have the steps. But a process is nothing without some guiding principles, right? To really bring it to life, professionals rely on 5 golden rules. These are the things that make sure the plan actually works in the real world, in a busy clinic or hospital room. And these rights are so simple, but so powerful. You've got right time, which means teaching when you're actually ready to listen, not when you're in a ton of pain. Right context, like having a private room where you can actually focus. And then the last 3, right goal, right content, and right method. They make sure the information is tailored just for you and delivered in a way you can absorb it, whether that's by talking, reading, or even watching something. And this brings us to a really crucial point. Teaching in a medical setting isn't like a simple transaction. It is deeply, deeply human. And its success really depends on understanding the whole person. You can have a teaching plan that looks absolutely perfect on paper, but it can completely fall apart if it doesn't account for the individual. Your internal state, what's going on around you, all of it plays a massive role in whether that information truly sinks in. Let's start with what's going on inside you, your motivation, and just your plain readiness to learn. That's huge, but so is your physical and emotional state. Think about it. If you're feeling sick or stressed out or totally overwhelmed, your brain's ability to absorb new information just plummets. That's why being actively involved is so critical. When you're part of the conversation, it helps you overcome those barriers and learn so much more effectively. Then you've got all the external stuff, the learning environment itself. Simple things like the timing of the session or how quiet the room is can make a world of difference. Was the information just dumped on you all at once, or was it broken down into smaller pieces with time for feedback? All these little details, right down to the quality of the communication, can literally make or break the entire learning experience. And of course, context is everything. Teaching a child is completely different from teaching an adult, right? Someone's cultural background can shape how they see health and what they're open to hearing. But maybe the most critical piece of the puzzle is something called health literacy, which is really just a person's ability to find, understand, and then use health information. A great teacher always meets you where you are. And to meet all these different needs, professionals use a whole bunch of different tools. This could be anything from a simple, easy-to-read handout to pointing you toward really credible websites and online resources. The whole goal is just to provide information in different formats to support everybody's unique learning style. All right, so the teaching session wraps up. But wait, the process isn't over yet. The follow-through is actually where the learning gets locked in for good. This follow-through part is so important. First, they'll check for understanding. A lot of times, they'll ask you to explain it back in your own words. Then, they document everything that was taught, so the entire healthcare team is on the same page. And finally, they reinforce that teaching whenever it's needed in the future. It's not a one-time lecture, it's an ongoing conversation. Look, if you take just one thing away from all this, let it be this. Effective patient education isn't about a provider just rattling off a list of facts. It's about a successful transfer of knowledge.
The real goal is genuine understanding that actually empowers you.
And that kind of leads us to our final thought here. Now that you've seen the playbook, you can see just how much deliberate care and effort goes into teaching patients. So the real question is, how can you meet your healthcare providers halfway? How can you become an even more active partner in your own learning and, when it comes down to it, in your own health?